The spinning thing stops. That means we're live. Hey, everybody, it's Friday. It's August. Hard to believe. Gray Stallman here. I'm your host. The Doctor's In Live with TOA is on Facebook. Scary but true. You may remember this smiling face. This is Anita Slaughter. Anita is a personal trainer. I don't even know how to describe you anymore because it's not just personal trainer, but she's our corporate training executive. We'll call you that.
Okay, I like that.
Anita's in charge of our Sports Performance Center.
The personal training aspect.
The personal training side
and
fitness stuff. So we have, TOA has Sports Performance Center both in our Franklin office and just recently opened in our Lebanon office. And Anita is over both of those programs, really trying to help to develop a robust process, not just for athletes, for everybody.
Correct.
To stay fit, be healthy, live a good life, both with personal fitness, with counseling, nutritional ideas, things like that. So it's really an exciting time for TOA, long overdue, I would say. And so I'm looking forward to talking again. Anita came on a few weeks ago, maybe a month or so ago, and we talked a little bit about nutrition and personal fitness. We're going to be kind of expounding on that a little bit more today. So we appreciate you being here. As always, remember that I am an orthopedic spine surgeon. I'm a fellowship-trained physician, but I am not acting as your physician today. I am merely the talent. I'm merely the host, and we're here to provide you with some information. We're not giving you medical advice. If you have a musculoskeletal problem, something's giving you trouble, don't go to Facebook, don't go to Instagram, don't go to TikTok. Go to TOA.com. We can help you understand some things about the things that might be going on, but more importantly, we can give you information there on that site about who to see for your particular problem. We have practices, offices all over the mid-state, from Knoxville to Columbia. We can help you find the answers to your musculoskeletal problems so that we can get you back in the game. Whether that's a real game, pickleball's a real game, by the way, which I love, or just life in general. We have ways of helping you. So TOA.com, go there, learn some stuff. Don't go to our competition. Although most of our competition is really good, actually. So, but anyway, they're going to hate me for this. Anyway, without further ado, Anita, thanks for being here.
Thanks
for laughing at my really terrible pun-like jokes. So you've been doing okay?
I've been doing great.
The opening at Lebanon, how that at Lebanon. It's not Lebanon, it's Lebanon. How did the opening at Lebanon go?
It was fantastic. We had a lot of traffic through there and a lot of interested folks come through. So
good.
We're excited to have them.
Awesome. Your hours there are currently?
Well, currently it's whenever someone wants to come see us because we can come in. I know the clinician hours are different from ours, so we have people coming at 5 o'clock in the morning to train currently, and I'm not sure what the latest one is. So
good. So, and where can people find information about your aspect of the Sports Performance Center with TOA?
So they can either go to the TOA website and click on the Sports Performance tab, or you can go to atrainfitnesscoaching.com and contact us there.
That's A with an A like Anita. Okay. Okay, so what do you want to talk about today?
So last time we talked a lot about myths and misconceptions, primarily focused on nutrition. So we'll talk about a few myths in fitness more related, and then move a little bit toward the benefits of fitness, exercise, with emphasis on strength training. And I'll reiterate what you said. I'm sharing things with you that are my own personal beliefs, my own personal experience, my own research that I've compiled over the last 20 years. So it may differ from what fitness professionals in your life may say, and as with anything, I always suggest you do your own research, contact your physician before making any changes to your fitness or nutrition program.
Awesome, great thought.
So the first one we'll talk about, and this is maybe as much of an excuse as it is a myth, but I have clients tell me, I can't work out every day or I can't exercise every day because I don't want to overtrain and have overuse injuries. And we get in our industry these buzzwords that come around applicable to fitness and nutrition every few years. And I think people gravitate toward those without really understanding what they mean or, the specifics of it. And overtraining and overuse injuries are examples of that. I still am going to recommend that you exercise daily. Just a little bit of physical activity goes a long way. Some people need more based on your lifestyle. I have a very physical job, so I may not have to schedule in as much as someone who's at a desk or someone who has genetic predisposition to different chronic illnesses and disease. Where overuse injuries come into play is when people do those same exercises day after day, week after week. Think like marathon runners. These endurance athletes are putting in lots of miles, lots of training, and that repetitive exercise puts them at risk for injury. So we're obviously not ever going to talk them out of running. So what we're going to do is encourage them to, one, incorporate some different aerobic exercises in, whether it be swimming or biking, cross training. Have undulating running programs, which varies their terrain, their speed, their distances. Add in a little bit of mobility training, such as yoga, and then incorporate some running specific strength training in to really protect your bones and joints. But for the majority of us, we're not doing that type of either extreme exercise or repetitive exercise. We're incorporating a little bit of aerobic, a little bit of strength, and a little bit of mobility already. Even someone who will only do strength training, and we know some of those, the way they design their workouts is they split it up into muscle groups. So they allow enough recovery in between workouts that they're not ever going to run into those overuse injuries. So bottom line is schedule something little, whether it be physical activity or active recovery every day, and inevitably life's going to happen and you'll get a day off here and there.
Well, I think that's a great point. We have this conversation a lot in my practice. Years ago, I was an endurance sports junkie, triathlon, cycling, and things like that. And what the big thing was doing the exact same thing every time, keep stressing those body parts, and you get an imbalance in the other body parts. And so you kind of promote this repetitive use injury. It's not a use injury, it's a repetitive use injury.
Correct.
And that's the fallacy that the people who make their comments say, oh, I don't want to exercise every day because it's overuse. It's not overuse, it's the repetitive use. And the key for those endurance athletes, if they start having a problem, is modify activities early rather than just pushing through, so it's an acute repetitive use injury rather than a chronic use injury.
Absolutely.
Because those are a lot harder to get rid of. And you will not lose fitness by taking it easy for a few days, letting your body rest. Somebody who's training for an Ironman triathlon will not lose fitness even if they take a week or more off to let their bodies heal, rest, and recover. Our bodies make our gains, correct me if I'm wrong, at our rest periods.
Exactly.
Not while we're doing it. It's actually the recovery process that's where our gains are really made.
That's exactly right.
And so rest is important. And rest doesn't mean sleeping necessarily, although it does mean sleeping. It means giving body parts a chance to recuperate and regenerate and heal.
Absolutely.
Yeah, perfect.
Yeah. And then the next one we'll talk about is aging slows down your metabolism. And yes, it's true. Our metabolism does slow down as we age, but it's not aging itself that slows it down. It's, beginning in our 30s, inactive individuals will start to lose 3 to 5% of their muscle mass per decade. And that's going to slow down your metabolic rate, increase your fat accumulation, and, that all sounds pretty terrible, right? But the good news is that's with inactive individuals. So those of us who incorporate exercise into our daily lives, we can not only slow down that process, but reverse it to some extent.
Yeah, I think that's very true. I mean, my patient population is a lot of older people where our bodies never get better with age.
Right.
Our bodies have a negative pathway. They get worse with age. So exercise, treating our bodies right, helps us to slow the symptoms of that process.
Right.
Slow some of that process and potentially reverse some, not all of those processes. So, it makes tons of sense. My mother-in-law was 91 when she finally moved here with dementia, but she was able to crawl around on her hands and knees and get pots and pans out of her cupboard at 91 because she just moved every day. And staying moving every day is really the best thing for our bodies, I think.
Right, and we can still improve that metabolic rate with aerobic exercise, and actually it can be a little higher during the exercise itself, but the benefit of the strength training is it'll boost it for long after the exercise is complete. And so that's why it's so important to incorporate the strength training into your program. We have people who come in and they're 40s and 50s, men and women, and they're like, I gained a little bit of weight and I always did a little cardio before and it's not working. So, and it's really difficult for us as fitness professionals to flip that switch and change their mindset to get them to see what they really need to incorporate is the strength training to get the results they're after.
That's a great thought because in my experience, because your muscle mass is your metabolic machine.
Right.
Like you said, you burn calories long after you stop doing your cardio or exercise. And so if we can keep that up, we can actually fight off that, sophomore slump or worse, my little belly thing here. You can help fight that off. I mean, that's actually more beneficial to you than the cardio exercise itself, the heart and lung stuff.
Right.
It is keeping your muscles strong.
Right. And, it's easier for people to focus on aesthetic purposes for weight loss. But for me, I really do try to get them to shift their focus onto the numerous health benefits you get from strength training, because you'll get the weight loss results naturally doing that. We'll discuss some of those benefits of strength training. I think the one that's probably will pique your interest most is the maintaining and improving our integrity of our skeletal system. So that aging process that slows down our metabolic rate, decreases our muscle mass, and increases our fat accumulation, also reduces our bone density. And just imagine, now we have weight gain on top of the reduced bone density, and we're at risk for fractures, and just imagine the stress that our joints are now carrying along with that. So we want to incorporate strength training to not only improve our bone density, but to improve our balance and coordination, which reduces our risk for falls, which reduces our risk for fractures, and really just gives us an overall healthier skeletal system.
Really good point, particularly for the female, who starts off in many cases a little bit less bone mass than men to begin with, physiologically. And then you guys have the advantage, if you will, of the hormonal changes in your body, which also alters your bone mass as well. And so anything we can do to improve our bone mass is a good thing. To try to prevent, the last thing you need is a broken hip in the hospital. Statistics that I learned when I was in training, 50% of older people who break their hip die within 1 year. And it's not because of the hip itself, it's because of all the things that happen because of the inactivity and stuff. So if we can avoid the hip fracture or the skeletal fracture, we actually improve longevity.
Right. And I think that, obviously we're focused on the strength training, but the weight control is an important aspect of that process, because not only are we reducing that strain on our joints and increasing our bone structure when we lose the weight, but we're also, I know in your instance, if you're doing surgery, the outcome and success recovery rate of someone when their weight is down is going to be significantly higher than...
Absolutely. And in fact, in the joint replacement world, there are fairly hard criteria with regard to if your body mass index, your BMI, which is a combination of your age, sex, height, and weight, there's a mathematical formula. If your body mass index, normal people are somewhere in the mid-20s, say. If your body mass index is over 40, your chance of developing an infection, a wound healing problem, and having a bad outcome skyrocket. And many facilities actually, if you hit that threshold of about 40, they won't let you come in to their facility to have joint replacement surgery because the risks are too high.
Right. And I think, like, if I come in here and you say, Anita, you're 50 pounds overweight, you really need to get this weight off for your health. And obviously that's probably information I already know, and I haven't been motivated to do anything about it. But if I have an injury or need a joint replacement or something and I can't get that and I'm in a significant amount of pain, that's a huge extenuating circumstance that will motivate me to get that weight off. So.
And interestingly, as you said about the extra forces on the joints, some of those people, when they lose the weight, their joints don't hurt as much, and they don't end up having surgery.
Right. Yeah. So it's
a double benefit there.
Right.
Besides the fact that you also help improve your health with regard to diabetes, high blood pressure, and cardiac disease.
Right, and I think people are very aware of the aerobic impact on your cardiovascular system, but I don't know if they realize the benefit of strength training for those chronic diseases like diabetes, obesity, depression, and heart disease. There was a study recently in the Medicine and Science of Sports and Exercise, and it showed that any amount of strength training weekly over an extended period of time showed a 40 to 70% reduction in not only heart attack, stroke, deaths related to heart attack against people who didn't do strength training and just did aerobic. And that was independent whether they did aerobic activity along with it as well. So I think those are some pretty promising numbers.
And they're very compelling numbers too.
Right.
Yeah, absolutely. So again, what does that tell us? We need to be moving.
We need to be moving.
And I believe in kind of the cross-training concept, which is cardiovascular, getting your heart and lungs moving, but really it's got to be married with strength training, muscular training, and flexibility.
Right, and that's still one of those myths that is difficult to get people to shift toward, but I think we're getting there.
Well, definitely people like you around, I mean, it's very helpful, because some people just need a little bit of insight, a little bit of education, and a little dab of motivation. And once people kind of understand things, I mean, they're very happy to say, "Oh,
right.
You mean I don't have to be a marathon runner in order to be healthy?" No, you don't.
Right.
Yeah.
That's exactly right.
All right. What else on your list of myths?
I think another benefit is your energy. So not just your energy improvement at any given time, but that sustained balance energy throughout the day. And this one's a really hard sell because when someone's tired and lacking energy, the last thing they're motivated to do is head off to the gym. And you're certainly not going to feel that benefit immediately, not the first day and probably not the first week. But then after a few weeks of consistency, you'll not only feel at balanced energy, but your quality of sleep will improve, and then you'll feel those little surges of energy throughout the day. Some people won't necessarily even realize it until they stop and miss a few workouts, and then they feel that drain, and they're like, okay, I have to have this back in my life.
Well, yeah, I personally can attest to that. We as a society or human nature likes to go with the quick fix, which is the coffee, the Diet Coke, the 5-hour energy boost,
right.
and sugar. And those are kind of the fakes.
Right.
Those give you a sense of energy, but quickly crash and burn. And what do? You get another cup of coffee or another Diet Coke. And really, my experience with exercise has always been, wow, it's lasting, you feel better, you sleep better, everything's more stable.
Right. And when you incorporate too much of those caffeinated supplements, then you can also mess up your
She's
adrenal
looking
system.
at me because I've got this right here. Yeah.
Your adrenal system can get a little out of whack, which is going to require you to have more caffeine. So, yeah, the best thing to do is to accomplish that through exercise. And, I don't know if you ever try this, but ice water or really cold water throughout the day, you'd be surprised. Sometimes you're just slightly dehydrated when you feel your energy drained. So, switch that out for some ice water and
Awesome.
good to go.
Awesome. Okay, yeah. We've certainly found, again, endurance athletes kind of found at first the whole idea of water. It's actually far more helpful to us. Our bodies are 90-something% water, and it's really helpful to understand that simple hydration makes a huge difference in how you feel, how you recover, how you look, how healthy your tissues are, and that's a biggie. And things like this is not water. This is, it's liquid. It's water in there, but these actually dehydrate you. The caffeine, the sodas, the artificial sweeteners, they increase your kidney output. and decrease your hydration. And so they actually are dehydrating for people. I'm merely using it because I'm getting paid by Coca-Cola weekly to fight Mark Zuckerberg. No, I'm teasing. I'm bad. I'll have one Coke a day if I need to in the midday after clinic, but that's my crutch. That's my coffee crutch, my caffeine crutch.
Right. Well, I think just like when people bring up the overuse injuries, I've also had people when they say your solution to everything is water when I complain about something, and I even have people will say, I don't want to get hyponatremia. I'm like, you don't really understand that process because nobody's drinking enough water.
Yeah, that's one of those myths that's been promulgated in modern conversation is, oh my God, all these marathoners get hyponatremia, low sodium, and die or have seizures.
Right.
It takes a lot to do that.
Right, and they're also sweating profusely and flushing out their electrolytes and not replenishing it, and if they're just drinking water. So that's where that comes into play. But the rest of us are not drinking enough water for the most part.
Yeah. And think about it. What's the most natural thing in our bodies? What's the most primitive thing in our bodies? The food we eat are things that are nothing that's processed, so it's all fresh. Vegetable, meat, proteins, etc., depending on your bend, but water. That's what we were designed to put in our bodies.
Absolutely.
Yeah.
So another probably myth is and I hate to bring this up because it rarely comes up, but I have people still with the strength training, and especially females, say, I don't want to bulk up, I don't want to get huge, I'm not going to do that. And if you really understand the way our hormone systems are developed, especially for women, we don't have enough testosterone in our bodies to really build up muscle mass. So, ask any man who's underweight and trying to put on a little weight with ridiculous amount of calories, ridiculous amount of strength training, and it takes him a long time just to gain 1 pound of muscle. So what you may see in that process, and I always say trust the process, you might have, for people who are already a little overweight, when muscle tissue doesn't turn to fat tissue doesn't turn to muscle. So when you're building that muscle mass, your fat is not disappearing and automatically. So you might have a little period of time where you feel a little bigger or way heavier on the scales. But if you will trust that process and give it the time, that's what's going to help that fat come off, and you're not going to be bigger overall. You're not going to weigh more, you're not going to be bigger overall.
And fortunately, in the modern era, particularly a female, in my opinion, I find a female's figure very attractive when they have some muscle mass.
Right.
And again, like you say, to get to be the female equivalent of an Arnold Schwarzenegger level of size, there are different categories of strength training people, but to get huge, almost all of them are on some sort of supplemental testosterone or growth hormone or something like that. I mean, behind the scenes to get that gigantic look. It's impossible to do that naturally because women aren't built that way.
Right.
And most men aren't built that way either.
Exactly.
So most men who are gigantic like that, they're on something or a combination of things. So,
true.
I think fitness is what we're after here, right?
Right.
We're talking about longevity, fitness, and we're not talking necessarily, cut fit unless you want to be that way. We're talking about healthy fit, and that's the mantra.
Right.
What you put in you, what you put out. That's what gets you where you want to be, in my opinion.
Mm-hmm. It's true.
Yeah.
Another thing people ask me a lot about is what supplements I recommend, and I tend to veer away from that a little bit. I do personally I do a full blood profile every 6 months. I see where I'm deficient and where I need to supplement. Our food quality over the years has changed some, and we may need to supplement, or our diet has changed and we may need to supplement to get all the vitamins and minerals we need. But I'm not ever going to recommend what you should be taking without seeing numbers. That's something your physician needs to look at and only incorporate. There are some things that are dangerous for you to have too high levels. So
that's really true. And some of the supplements back, what was it? Years ago, it was ephedrine was a big supplement. Yeah. It was in all the energy drinks, and we had a ton of people who got sick and even died during anesthesia, being on ephedrine, and they just never mention it to their anesthesiologist, and it can cause cardiac issues. It can cause heart rhythm problems, and that's where that substance has essentially been banned, as far as I understand, as far as mainstream, because it was found to be actually quite dangerous without really knowing it. We all thought, everybody thought, oh God, it's okay, it's fine, it's available, it's over the counter, you know, it's going to be great. And really it has a consequence. So any type of supplement, as you said, you should discuss it with your physician with regard to your general health. Never rely on your Google MD degree, okay? Now, many of the supplements are harmless or relatively harmless if used in moderation.
Right.
Mega dosing of anything is not a good idea,
right?
In my opinion.
We usually call some of those expensive urine because you didn't retain any of it and you spent money on it and it just went right out of you.
Right, exactly. That's so true. So it's like mega dosing of certain vitamins your body makes as much vitamin as it needs, and the rest of it you just pee away.
Right.
And so it's just a waste. Polluting the waters. Very big fish with vitamin C overexposure. Yeah. Awesome. Any other tips before we go?
The one thing I do want to say, people are going to ask me how much exercise is appropriate for us, how much strength training do I need? And just like I said in the last segment, there's not a one-size-fits-all approach to everything, so I'm never going to recommend a specific eating plan for one person that applies to all, and I'm never going to recommend a fitness program that applies to all. So we generally will take a client through and do a very thorough fitness assessment, look at their health history questionnaires, look at their flexibility and what their schedule allows for them to work out. What time commitment are they going to give us to work with? And then we will personally tailor a program that will fit their own needs. So.
Yeah, I was going to finish up with kind of what's your process. So thank you for going that direction. We all recognize that nobody has 24 hours a day to commit to their personal bodies, but it is a commitment. It's a date with yourself for your longevity. I mean, it's only benefiting you and your family and everybody around you to commit to that. And the excuses, they're excuses. Okay, you can get healthy and fit with a very minimal time commitment if you're willing to commit.
Right. It's
just staying with program. And so the analysis, the evaluation, I'm sure you talk about what you've done in the past with regard to exercise or fitness, or if it's a weight management kind of approach, what have you done, what hasn't worked, what's worked, that kind of thing. What are your injuries, what kind of problems do you have with your skeletal system, and then you create a plan to introduce somebody into that commitment and get them charged about that commitment. And that's where the games happen, right?
Absolutely.
Yeah, awesome. Well, this has been really terrific. Again, I invite you to come back again. This will be a never-ending topic, which is actually a good thing because I'm pretty passionate about just general health, fitness, what we can do for ourselves, because unfortunately Father Time always wins. What we're trying to do is make the battle a little bit more even, and this has always interested me, and it's never anything about extremes.
Correct.
Health and fitness is not about extremes. You can go to the extremes if you want to, but you don't have to. So come back again. Okay, I appreciate it. Okay,
thank you.
Guys, have a great weekend. Again, go to TOA.com. All needs musculoskeletal on the website. Go to our media center. You've got all of the past episodes of The Doc Is In. You can go back. It was probably about a month, 6 weeks ago, I guess.
Probably.
That Anita was here before. Go back to that one. It was very useful. It was a very good conversation. We also have some, tips and tricks from our various practitioners about how to do things, how to take care of yourself, what to look for, keep yourself out of trouble when it comes to staying active and staying healthy. You can make an appointment online at TOA.com if you want to. Anyway, link down below, comment down below. If you have any questions, we'll get them to Anita if they apply to her. If they apply to me, please, I'm happy to answer questions. If you have comments or criticisms, please, I want to hear them. We want to make this your show to make it interesting for you, so you want to come back. I know we've got some super viewers, which we really appreciate. Tell your friends, tell your relatives. Have a little fun with this. We're trying to make this information as transparent, as open as possible, and as pertinent to you as possible, to try to help improve your lives. So I appreciate it. I appreciate the loyalty of the folks who've been watching us from the beginning. Carlos, you know who you are. And thanks again. Case, what are we doing next week?
Well, I'm still trying to confirm our guest for next week.
Okay.
It's supposed to be Dr. Korn, but I haven't heard back from him yet. So if not, we'll be here.
Okay.
Then. Yeah.
So thank you. So Dr. Korn is one of our foot and ankle specialists. We've been really hankering to get a foot and ankle specialist on board because we haven't had anybody with foot and ankle except Dr. Thompson about 6-8 months ago. So hopefully Chase Korn can come on board and we can try some foot and ankle topics. If not, I'll figure out something good. I've actually got a really kind of weird topic to chat a little bit about regarding spine. If you want to get a heads up, go to either where you get your podcasts, or if you stream on Peacock, look up Dr. Death, okay? That's just a little teaser. I'm not Dr. Death, by the way. But worth looking into. It's an interesting, serious topic that speaks a lot to me because I'm a spine surgeon, and it is concerning to everybody out there. When you look at the or listen to the podcast or look at the show on Peacock, you'll understand what I mean. But I'd love to talk a little bit about that Dr. Death topic and how it really relates to reality in the spine world. Okay, so till next time, next Friday, noon Central Time, Friday, the doc is in. We'll see you next week. Take care.